We'll give folks about another few seconds to get logged in and set up, and then we'll begin. All right, we'll go ahead and get started. So first, a few logistical and technical things. So this webinar is being recorded and it will be available on the ASHE YouTube channel sometime probably mid next week or so. Also, if you need access to live captioning, it's available at the bottom in your Zoom menu bar at the bottom. Just click the CC button and Tina is live captioning the event for us. Also, our panelists will answer questions either throughout or at the end, and you can use the Q&A function to send them questions. And without further ado, I will turn it over to today's wonderful moderator, Coco.
Mahalo, Jason. Aloha mai kako. Welcome everyone to our webinar on communities of color, higher education, and COVID-19, the depth of inequality. Mahalo, Dr. Carrie-Ann O'Meara, for including this panel as part of the 2020 ASHE Presidential Webinar Series on the existential crisis and equity imperative facing higher education. Communities of color have been deeply affected by COVID-19, from being disproportionately represented among diagnoses and deaths, to bearing the brunt of racism and xenophobia. Today's panelists will speak to the complex ways that students and educators of color, as well as their communities and families, have been affected by the ongoing epidemic. My name is Nicole Alia Salis Reyes. I am an assistant professor in the Department of Educational Administration at the University of Hawai'i at Mānoa, whose research explores how Indigenous communities and communities of color define post-secondary success, along with the responsibilities that institutions of higher education have in supporting those forms of success. This year, I'm also serving as the Indigenous Relations Liaison for the ASHE Program Committee. I will be moderating our webinar today. We also have with us 4 distinguished panelists who will share their knowledge with us. I'd like to introduce them to you. Dr. Shaun R. Harper is a Provost Professor in the Rosier School of Education and the Marshall School of Business at the University of Southern California. He also is the Clifford and Betty Allen Chair in Urban Leadership, founder and executive director of the USC Race and Equity Center, and a past president of the Association for the Study of Higher Education. He is the current president of the American Educational Research Association. Dr. Harper's research focuses primarily on racial and gender equity in K-12 schools, colleges, and universities, and corporate environments. This past July, he testified to the U.S. House of Representatives in a hearing on the reopening of colleges and universities. California Governor Gavin Newsom subsequently appointed him to a statewide task force on equity, higher education, and COVID-19 recovery. Dr. Desi Lonebear Rodriguez is a citizen of the Northern Cheyenne Nation and Chicana. She is an assistant professor of sociology and American Indian Studies at the University of California, Los Angeles. She has partnered with Indigenous communities in the US and internationally as a researcher and data advocate for more than 10 years. Her research examines the intersections of race, indigeneity, data, and inequality. She directs the Data Warriors Lab, an Indigenous social science laboratory, is the co-founder of the U.S. Indigenous Data Sovereignty Network, and serves on the board of directors for the Missing and Murdered Indigenous Women's Database. Dr. OiYan Poon is a program officer at the Spencer Foundation, an associate professor affiliate in the Department of Educational Policy Studies at the University of Illinois at Chicago, and a faculty affiliate in the Higher Education Leadership Program at Colorado State University. Her research focuses on the racial politics and discourses of college access, higher education policy, affirmative action, selective admissions practices, and Asian Americans. She is a lead co-author of amicus briefs written on behalf of social scientists supporting race-conscious admissions in Students for Fair Admissions versus Harvard. Vanessa A. Sansone, or Dr. Vanessa A. Sansone, is an assistant professor of higher education in the Department of Educational Leadership and Policy Studies at the University of Texas at San Antonio. She is an expert on racial, spatial, and class disparities related to higher education student retention, access, success, and how institutional, state, and national policies impact these issues. Her areas of research interest focus on understanding college affordability, Hispanic serving institutions, governance structures, and the geography of post-secondary opportunity, especially for students from Latinx, military-affiliated, and rural backgrounds. She was named as one of the 35 most outstanding women in higher education in 2020 by Diverse Issues in Higher Education. Thank you so much to all of our panelists for joining us today. We'll be going through a round of 3 questions, and we'll end the panel with question and answer period. Before we proceed, I'd like to take a moment to reflect on land. Although we may be joining each other virtually today, we are also able to do so grounded by diverse lands, each with their own names, histories, and relationships. I find myself fortunate to be able to join you today from Kaupai'aina o Hawai'i, the ancestral lands of my people, Ngākanoka Maoli, and more specifically from Mānoa, which is located in the moku of Kona, an area where members of my ohana have lived for more than 6 generations. I am grateful for this aina that has sustained my ohana, my people, and the people of Hawaii for so long, and strive to fulfill my own kuleana or responsibilities to this place and all that I do. While COVID has called us to limit our travel and social interactions in efforts to curb the spread of the disease and protect our communities, I hope that it also provides us with time to reflect on the lands where we live and work, as well as on the relationships that we have or aspire to build with them. Such reflection can provide a vital first step to the work of decolonization, work which must go hand in hand with the dismantling of entrenched racial inequities, which is the focus of our discussion for today. So thank you again, everybody. So our first round of questions is going to go out to all of our panelists. And that first question is, how has COVID-19 impacted the communities that you study, work with, and belong to? Furthermore, what structural inequalities impacting these communities have been laid bare by the pandemic? And if Dr. Lonebear Rodriguez, if you could get us started, be much appreciated.
Can you hear me? Perfect. Thank you for that question. Thank you, everybody, for being on the call, and I'm honored to be here. I want to acknowledge that I'm calling in from my homelands on the Northern Cheyenne Reservation in southeastern Montana. I acknowledge our Tisistats and Sutat ancestors, also known as the Northern Cheyenne. My reservation, my community here is being incredibly hit hard right now by COVID-19. And I want to talk a little bit about that. But first, to just kind of get perspective of COVID-19 and Indigenous communities. You know, ultimately, this pandemic is shining light on the cracks in all of the systems. Of course, health systems, but also education, housing, justice, and data systems, among others. And the thing is that the disparities that are making headlines in this country are nothing new. Many of us were born in these cracks that mainstream America are finally seeing. And we've learned not only how to survive in these cracks, but we've learned how to thrive in these cracks. And for Indigenous peoples, what the pandemic is confirming is what we have always known, that we are our only defense. That ultimately, I think the most powerful structural force at work in exacerbating the pandemic right now in our communities is an erasure, Indigenous erasure, which is part of this ongoing project of settler colonialism. And so, our people are not only disproportionately represented in the incidence, the actual positive rates of COVID-19, but we are dying at far higher rates. And what is really striking right now is I have never seen American Indians and Alaska Natives in mainstream media as much as I have since this pandemic has started. We have seen, coverage by the New York Times, the Washington Post, CNN, NBC, all of these mainstream media outlets covering, the high rates of COVID-19 in our communities. But I think what's really important is that, a lot of these poor people are being hit so hard. What we need to do something. But what isn't being talked about is that this is the result of generations and centuries of broken treaties, of erasure and invisibility. The most successful ongoing project of segregation in this country are Indian reservations. Come to an Indian reservation out in the middle of nowhere. We continue to be invisible, and it's very intentional. And so the disparities that we experience, across all sorts of health and social and educational outcomes also continue to be invisible until there is a national, international, global emergency like this. And so I think for me, my work and my advocacy is really centered on how do we continue to fight back against erasure and invisibility, and how can data be used to support those efforts. And so right now in my community, we've lost 20 people over the last 4 weeks. And that might not seem like a lot on my reservation. We only have 5,000 people that live here, however. And so when we think about that proportion and we apply that to the whole population of the United States, that's 1.3 million people who would have been, who would have died. And so tribes are in crisis. Our communities are in crisis. And so I guess, for me as a researcher and as an educator, it's just really critical to continue to amplify the structural what underpins this crisis in our communities. It's nothing new at all. So thank you.
Thank you, Dr. Lonebear Rodriguez. Oh, go ahead.
Sorry, I wasn't sure if you wanted to transition. Apologies, but thank you so much for having me here today. Greetings from Chicago. I want to respectfully acknowledge that I reside on the lands of the Kickapoo, Peoria, Potawatomi, and Mia peoples and tribes. As the US-born daughter of settler immigrants from Hong Kong, which is a colonized and very contested territory, I am mindful of my responsibilities to use my structural power and privileges to work in solidarity for projects of decolonization and racial justice as a scholar, leader, teacher, mother of a kindergarten student, and a community member in general. With regards to the pandemic, I wanted to share this visual that I found on some data with the audience. This is a data visualization by AAPI data out of UC Riverside, and the data source is the Marshall Project. And it's basically the percent increase in the deaths in 2020 compared to the last 5 years by racial group. And so we are certainly, as Dr. Rodriguez mentioned, in the midst of death, increased death, and something to be mindful of to situate us with that data. It's kind of odd. I was contemplating about how I am in some ways, representing this very, talking about Asian American communities in particular, but also, when we talk about Asian Americans, oftentimes terms like AAPI come up. And so this is a massive, diverse group. And so I've been really meditating on that and what that means. Asian Americans and Pacific Islanders as a racial group, grouped together by the federal government. It's a population with the highest within group socioeconomic status inequalities. So we have folks on the highest end of the SES spectrum and folks with the lowest measures of socioeconomic status. And they're all part of this very large and diverse community. I want to talk about 3 things about how the pandemic has really laid bare some structural inequalities. I've already talked about the data and the death. Pacific Islanders especially have been hit very hard. Some reports are saying that are showing that Pacific Islanders are being hospitalized at 10 times the rate of all other populations, and they represent the group with the highest infection and mortality rates in 3 different states. And outbreaks have also been reported in Cambodian and other Southeast Asian communities. Secondly, when you have this racist capitalist logics within this society, we have this, what I've been really troubled by is this disposability of frontline workers in general, but frontline workers make up a large segment of the Asian American workforce in healthcare. You have nurses, medical techs, therapists, medical doctors, cafeteria and janitorial staff. Asian Americans make up, all of these segments of the healthcare industries. Some East Asian presenting, so Chinese presenting healthcare professionals have reported being rejected by patients because these patients are fearful that these medical staff are more likely to have and transmit COVID. Very racist presumptions. And then also, there's service and hospitality industry workers, right? And so I saw this image very recently that I think on Twitter someone had captioned it the most 2020 image that we have, right? So we have Southeast Asian American women, especially Vietnamese women, who are very highly represented in the nail care industry, salon industries, professional beauty services. And so I think a lot about these segments of our population and community and concern for that. And of course you have Republicans, particularly the occupier of the White House right now, refusing to call COVID anything but the Chinese virus or a Kung flu, and how that is then exacerbating hate crimes and violence against Asian appearing presenting individuals across the country. I'll end right now by just sharing that a very good friend of mine, her mother is a war refugee from Vietnam. And this friend of mine told me that her mom had shared with her that in all of her life, including being in a war-torn country in Vietnam during the war, this moment in her life here in the Bay Area in California feels worse in some ways than living through war in Vietnam. The structural inequalities for API communities are being revealed through health and economic impacts, and none of us are really safe from a lot of the rhetoric and everything else. So thank you so much for letting me share.
So thank you, to the panelists. Thank you to ASHE and Dr. Reyes for having me on this panel. I'd like to take a moment to mention and acknowledge that I'm coming from you from San Antonio, Texas, which is on the ancestral lands of the Jumanos, Tanakawa, and the Coahuitecan tribes that have been a part of this land and still are a part of this land. I also, in that same regard, with regard to land and geography, would also like to take a moment to mention that I also come to you from a land that has the highest rates of poverty of any major city in the United States. So that means San Antonio, Texas beats out cities like Los Angeles, Atlanta, New York City. At the same time, we have a majority minority in this city, and particularly in South Texas, where we have a large Latinx population and community. And so how this pandemic has affected us is with regards to the demographics and the characteristics that were already in play before the pandemic hit. And, not only the poverty, but to give you another way of thinking about this too, but the Latinx community in the United States is the only racial and ethnic community who has yet to recover from the 2008 recession. So if you think about that for a moment, what does that mean in terms of layering with this new pandemic and the recession that we're already in the midst of and probably will continue to be? And what we've seen is that this pandemic has impacted us in disparate ways, just like most racial and ethnic communities in the United States. But I think what makes it also interesting is that the current administration continues to hold our community and our gente as the scapegoat to what's going wrong in the United States. I think that's important when you think about this in terms of the greater organization of education, whether it's K through 12 and higher education, because now you can see the layering of concerns and stressors and anything that the Latinx community has to navigate. Much like most of the racial and ethnic communities, we see large disparate numbers in terms of deaths and people just outright hurting. And so what we find is that, again, poverty, but health concerns and overall more morbid deaths are happening at a higher rate in parts where large Latinx communities live. So I point to places in South Texas, I point to places in California, I point to places in New York, where we're just seeing people having to make these tough decisions, really because the system was already against them. And so when we talk about health becomes an interesting topic for the Latinx community because there's already mistrust with regard to health and health decisions. And so much like my colleagues, from the other communities, the racial and ethnic communities at large, as we start to rely on each other for information. And sometimes that tends to not be the best way to navigate a pandemic. And we also tend to believe sometimes that our government has the best interests for us. And those are white ways that we've been, socialized to believe through education. And those are ways that as scholars of color, critical race scholars, we're trying to push back and have our community think about and make better decisions on what to do for each other. That's not to say that this is all on the backs of us as individuals in this community. There's systemic racism and classism and disparaging just ways of being and existing that make that a lot more difficult and complex to think about. But at the end of the day, I mean, the comments are that we're being killed at a faster rate than white Americans in the United States.
Hi, it is a pleasure to be here with you all. Thank you for including me in this important conversation with members of our academic community. I am joining from Los Angeles, the native lands of the Tonga people. I just put a link in the chat to an article that I recently published in the American Journal of Education, and it's about COVID-19 and the racial equity implications of reopening colleges and universities. I wrote this particular article because back in June, I started reading these reopening plans that colleges and universities were posting to their websites. Some of them were active living documents, so I could see them as they were being built and revised. It was really striking to me. On the one hand, such extraordinary work was being done to think about how to reconfigure classrooms and labs and residence halls and dining halls to permit physical distancing. But on the other hand, those plans were horrifying to me because they lacked any attention to race and to the communities that I study, communities of color generally, and Black communities in particular. It was really clear to me that well-intended college and university leaders and faculty members who were working on these reopening task forces were not thinking about my people. They were not thinking about Indigenous persons, Asian American and Pacific Islander persons, multiracial persons, Latinx persons. So I wrote this piece in which I offered 12 racial equity implications of reopening campuses. In the interest of time, I will only lift up a handful here. Let me preface this first one with an expression, a very sincere expression of condolences to those of you who have personally lost people that you know and love to COVID-19. One of the things that I offer in the article is that we know irrefutably from the data that communities of color have disproportionately been affected by infections and by COVID-19 deaths, which means that when members of our communities return to campus, either virtually or to the physical campus, people of color are more likely than are their white classmates and their white coworkers to be grieving and mourning the loss of people in their families and communities. So we really have to think very deeply about ensuring that we have the appropriate mental and emotional wellness resources for those members of our campus communities who have been disproportionately devastated by loss. I, like Dr. Poon, I also have been thinking very deeply about the racial stratification of the higher education workforce. She is exactly right. When we look at workers who are in maintenance, custodial, food service, and groundskeeping roles, those roles are oftentimes considered essential roles. They've been essential to campus operations. Overwhelmingly, people of color are concentrated in those positions, and I'm worried that not enough attention is being paid to exposing those workers to the risk of contracting the virus and then taking it home to their families and to communities that have already been disproportionately ravaged by the coronavirus. So we have to ensure that we have the appropriate PPE, cleaning supplies, contact tracing, and testing for those employees who are doing work that is considered the essential work of college and university operations. I've been thinking a whole lot too about the looming recession and the financial fallout from COVID-19, and more specifically about the racialization of furloughs, terminations, and layoffs. It is those people of color who are in those positions that OiYan and I have talked about who are unfortunately and most disgustingly considered to be disposable to colleges and universities. People of color in the roles that they occupy, I think are most vulnerable to those layoffs, to those terminations, to having their hours reduced, or to being replaced by lower cost workers who can do that so-called essential work. So it is important for those of you who study economics in higher education to bring a racial equity frame to your analyses of the financial fallout and the shifts in the higher education workforce. I am afraid that if no one is paying attention, that people of color will be overwhelmingly devastated by the financial fallout. Just two more things that I offer in the article. I've been thinking, obviously, as I always am, as an alumnus of a historically Black university, I am thinking about the racial equity implications for HBCUs, other minority serving institutions, including tribal colleges, as well as community colleges that disproportionately educate large populations of students of color. This summer, I was on the phone. This is with some of the K-12 work that we do here in the USC Race and Equity Center. I was on the phone with the head of school for a very elite, well-endowed private prep school. And she, was apologizing for the banging that was happening in the background. And she said to me, the construction workers are here, reconfiguring all of our labs and our classroom spaces and all of that stuff to ensure the physical distancing of our students when they get back. What I thought about in that moment is that institutions that historically and contemporarily continue to be chronically underfunded, that will be HBCUs, minority serving institutions, and community colleges, don't have the wealth to rebuild, reconfigure, and do all of the things that were being done in this well-endowed, wealthy private school. So I worry about that. And the last thing that worries me as a person who writes and studies about race in college sports, I think it is absolutely reckless that we're playing football right now, particularly at the athletic conferences that are represented in the, or located rather, in the southern states. As I was reading those campus reopening plans, many of them, especially at universities with big time college sports programs, many of them included very sophisticated models for reconfiguring the stadiums and for ensuring physical distancing where, you know, every third seat is empty, so on and so forth. You know, that it became really painful for me as I realized that a lot of attention was being paid to ensuring the safety of a mostly white spectator audience who show up to big time college football games. No attention was being paid to the Black men who are on the field, literally engaging in a contact sport, passing an object from one to another with no hand sanitizer. Like there was just no attention being paid to the fact that Black men comprise just about 2.5% of undergraduates at the Power 5 athletic conferences. But yet they're more than half of football and men's basketball team members. So yeah, those are the things that I'm thinking about. I'll pass it back to Coco.
Thank you so much, everybody. You know, this is clearly an issue that has had a great impact on all of our communities. So the second question that I have is, how have communities, again, that you study, work with, belong to, how have they been responding to the challenges that they face due to the pandemic? And what roles should higher education institutions take in supporting these communities, not just now, but into the future? And I think, you know, Dr. Harper, you began to talk about this, but I hope we can continue to expand upon this through our discussion.
So
I can pass it to Dr. Sansone. Yeah.
Thank you, Coco. So, you know, in working with the Latinx community, a lot of my work has recently focused on populations outside of metro areas. And so I think that's important because when we think about access and inequity, you begin to really get a clearer picture of who has access to what and why. In the context of the pandemic, we can see how access to basic necessities like water resources, like healthcare access, educational access, began to give us a deeper picture into what is inequitable and for whom too. That's where I think the conversations about land and where these institutions reside is so important, because these are additional barriers to our Latinx community that really began with pushing us out into places where we were othered, right? And this is a common strategy, common colonizer strategy that we'll probably hear and see commonalities between other racial and ethnic groups. But that's really where the work that I've been doing has focused on. How these particular communities have responded is it's uplifting because, you know, they own their assets, they own their resiliency. But at the same time, I think it's important to talk about the way that higher education makes this more difficult and requires more upfront investment and resiliency from these communities and communities of color. I get tired of hearing about theoretical frameworks and particular practices that focus on such topics related to grit, meritocracy, picking yourself up by the bootstraps. Those are things that get in the way of really thinking about and addressing these structural inequities that make us think that all we have to do is just find the resiliency within and we'll overcome. And that's ludicrous and unfair to these populations. Again, you know, that's where I see these, you know, these thoughts between the Latinx community, specifically in areas that are outside of metro places where they're having to make really tough decisions about whether to go to college or not right now. And that's because their survival is what is most important. Because as we've shared already, they're dying. We are literally dying in these places. And so where do you make decisions about going to college? Where's the importance in that? And this is where higher education should realize that, think that it's not the most important thing in communities of color's lives, and begin to shift and change the way that they do organizational practices and the way that they help these populations. Because this demographically, if that hasn't been clear yet, not only are these populations demographically facing disparities in terms of COVID, but these are the communities that population-wise will be the majority of the United States in the next coming years. We've already seen that from the demographic numbers, and I'm sure Dr. Lonebear Rodriguez can definitely speak to some of that based on her research.
So picking up a little bit on what I was sharing earlier, in terms of how AAPI communities have responded to this moment, I want to talk about a couple things. Just yesterday, there was a report released out of San Francisco State, out of this collective community and university center called Stop AAPI Hate. Just Google Stop AAPI Hate and you'll find it. But in the last, I guess, 6 months, this grassroots community engaged research effort happened where there was a document, why wait for any government agency or university to start collecting data on the increase of hate and violence against AAPI communities. This group of community-based interest organizations and researchers across the country created this center. And they have documented the thousands of bias and hate and violence that has occurred as a result of and spurred on by calling the coronavirus the Kung Flu or the China virus. But I also want to flip a little bit and talk about, this ongoing historical pandemic of racism in general, and particularly anti-Black racism. We're also in a moment of upheaval around, protest against anti-Black racism with the murder of George Floyd in Minnesota. I was recently watching Hasan Minhaj's quick YouTube video from the Patriot Act, which is no longer happening, the Patriot Act. But this, if you just quickly YouTube, we cannot stay silent about George Floyd. Hasan Minhaj says, we think we're not, and when we say, he says we, he's talking about Asian Americans, we think we're not a part of the story of anti-Black racism, but we're at the scene of the crime. You may recall that there was a Hmong American officer covering up, essentially blocking the view of the officer killing George Floyd. And he says, that's why the full picture matters. This doesn't happen in a vacuum, it happens in a system. And so there's this very complicated moment that we're in where Asian Americans are being targeted by racism, right? And also we are part of this system that we really need to deconstruct and dismantle. We need to act. And he actually provides several steps to do that. I was in tears watching this video. I highly recommend this video. Another way that AAPI communities have been responding is, I got to shout out Dr. Connie One over at AAPI Women Lead. She has been doing this phenomenal series on collective self-care, I think. It's called community care, collective community care. As some of my colleagues have already talked about, our communities have had to come together, and we would not be here if it was not for our community's resilience over the centuries. And so we have these strengths in our community, and we need to just, tap into it. And it would be lovely for universities to invest in it and researchers to recognize that, as Dr. Sansone was talking about. And we can't wait, right? We have to do for ourselves as well. And so I highly encourage folks to take a look at this community care series. Several of the videos, very short videos, actually talk to anti-Black racism and the complicity of Asian American communities and what that then means for us and what we need to do systemically as well, but it also has several videos about what it means for people to give birth in this moment, trans brilliance, building coalitions cross-racially, sustaining our physical and mental health. That's another way, you know, mental health issues are definitely on the rise in this moment for many, many reasons. And so, yeah, I'll just stop there. We got to do for ourselves. We can't wait, but it'd be lovely for these mainstream institutions to continue investing as well at the same time.
Let me pick up actually where you just left off, OiYan, talking about mental health. I've been thinking recently about the effects of the predicted effects of the pandemic on students' college going behaviors and college aspirations. And I think that that's where we're going to see yet another manifestation of racial inequities. Again, given the disproportionate loss and death in communities of color, I think it's going to be very hard for a now 16-year-old or 17-year-old, I'm going to use traditional age college students for this example, but I think that if you're 17 and a whole bunch of people in your family and in your community have died, I just don't know that your depression is going to inspire you to submit a whole bunch of college applications and to do a full-on college search and so on. So that worries me a lot. Another thing that worries me, again, I put a link to the American Journal of Education article in the chat. I wrote in there about the racial violence against Asian and Asian American students and workers, and how we've seen just such nasty, ugly, terrible racism, xenophobia, and xenophobia throughout the pandemic. And Asian and Asian American folks, or anybody who appears to be Asian, you know, the news stories have made very clear to us that, you know, those people are feeling unsafe because of the violence and discrimination and harassment that they have experienced and continue to experience throughout the pandemic. All of those plans that I read, those reopening plans, they mention nothing about how to ensure both physical and psychological safety for Asian and Asian American students and workers on campuses. That's another thing that we ought to be studying and that we ought to be thinking about and creating policies and practices for as we continue to educate during and beyond the pandemic.
I'd like to make a few comments. I apologize, my connection is unstable, which I guess just kind of is a case in point for the fact that in a lot of Indigenous communities, we have massive technological divides, massive connectivity issues. We have one, you know, internet service provider that has a monopoly over everything, and it's incredibly expensive to get Wi-Fi and internet in a lot of our communities. And so, you know, a huge issue with virtual learning. What are students going to be, you know, what can they do? And I know that there are so many families and children who are essentially sitting in crisis. You know, they're at home with very limited internet and connectivity, and I'm very concerned about what's going to happen long term in exacerbating educational inequities. But I want to just pick up on a few things that Dr. Harper mentioned about mental health and wellness. One of the things that I think we cannot underestimate in Indigenous communities is the long-term effects and intergenerational trauma that is going to emerge from this pandemic for Indigenous peoples and for, you know, lots of different racial and ethnic groups. But I want to kind of hone in on Indigenous peoples because of our disproportionate rates of COVID and mortality, and of our also because of our very, very complex and critical funerary rites and ceremonies that come with that, and our inability to mourn and to grieve and to sing our people home. You know, we're experiencing that now in our communities. And it's not just those who have died from COVID-19, it's all of those who have died since the pandemic has started. And so I think to me, or for me as a relative and as a community member and as a Cheyenne woman, I'm very concerned about the kind of long-term trauma that's going to come from that in our communities. But unfortunately, I was cut short in the first question because my connection was unstable. But I want to mention a couple of things that I think are being incredibly overlooked right now that are signaling red flags in this country for Indigenous peoples. And one is the threat against tribal sovereignty. So there are 574 federally recognized tribes in this country. There are hundreds of state recognized tribes and other tribal nations who are seeking recognition. But sovereignty of tribal nations, Asian, the authority that tribal nations have to govern their people and their lands exists completely outside of the sovereignty of the federal government. And yet we're seeing real encroachment on that. For example, the Trump administration in the middle of this pandemic has sought to disestablish Indian reservations. We're seeing, for example, with the CARES Act funding that was passed, in order to access that funding, American Indian tribes are the only entities that had to send proprietary data into the federal government, to the Treasury Department, proprietary data on their funding sources, on their tax status, on their citizens, information that no other entity had ever, would even consider having to submit in order to actually just qualify for funding and for relief. And so tribes had to send that in. Essentially, they were being held hostage. If you don't send us these data, we're not going to release federal funds. And one of the most insane things that then transpired was there was massive data leaks. So all these tribes sent in all this data on their funding sources, their tax status, their citizens, and the data were leaked internally to within the federal government. And so we're seeing these threats against tribal sovereignty that are real, that are going to have lasting impacts. And so I'm just very concerned about that. I want to talk about what Dr. Poon had mentioned about employment. I believe it was Dr. Poon, it might have been Dr. Harper, about it was Dr. Harper, about the long-term impacts of employment and the impending recession. A lot of people don't know that, in a lot of Indigenous communities, seasonal work is how a lot of people get by. Seasonal work, firefighting, seasonal work on road construction, that source of income sustains families for the whole year. Well, that has been completely disrupted. And more importantly, the Trump administration, the administration has, Congress, I guess I should say, has failed to reauthorize and extend the COVID unemployment supplement. So, families who were, receiving unemployment were getting an additional $600 a week. That's gone as of July 31st. And so I'm very concerned about what's going to happen long term, especially as the winter months, come about how families are going to just make it. So I want to just mention that, and of course, what can higher education, what can be done? Indigenous communities that are trying to keep their doors open. I think that is something that, our tribal colleges and universities are not just educational institutions, they're community serving spaces, that I think need to continue to get relief funding and support. And I want to just leave it there because I have a lot more to say, but I just want to open it up. I don't want to take up too much time, but thank you.
Mahalo, everyone. As with many great conversations, this one has gone very quickly, and we find ourselves with less than 10 minutes left. And so with that in mind, I thought it might be a good idea to transition into some of the Q&A that we've received. One of the things that I was hearing while listening to your responses to the second round of questions is this theme of mental health care. How do we take care of one another and really support our students who are being disproportionately affected by loss, grief, and just general stress about ongoing life at this time. And so we did receive a question that was about related to mental health from Lisa Norton. She says that that she's been seeing an increase in suicide rates and mental health concerns, which is disproportionate both intersectionally and on class and race. What are some good examples of what universities or faculty are doing to help alleviate some of these issues?
Well, I can take the first discussion about this, and thank you, Dr. Norton, for bringing this question up, as it's a very important topic, as the panelists have pointed out. But I'll take a slice of this conversation, and I really want to put it back towards faculty. Particularly faculty in Hispanic serving institutions, where a lot of my work is done. And what we're seeing is that there's consideration for all of these things that we're talking about in the development of our curriculum and curriculum design. And it's with a conscious effort to not contribute to the mental health stress and the mental trauma that students are experiencing outside of the classroom. And so I think it's important to also briefly talk about this in the digital space. And so how do we unlearn or rethink some of our curriculum design that we've been doing in face-to-face, that we really need to think about how this can best support and provide an ethic of care for our students, particularly those in my spaces of the Latinx community. What I try to do in my own work is I try to make sure that I'm considering the digital inequities, the class inequities, and also the pushes and pullers like childcare, or the fact that a lot of my students are the primary healthcare providers for not just their children and their partners, but a lot of times for their extended family. And so things like requiring students to have their cameras on, things like being really punitive with time, right? This idea of like time. Those are things that we really have to rethink and negotiate if you really want to support and not be an additional stressor for our students. What we'll probably see, and this is again being predictive and suggestive here, I don't have any empirical evidence to support this, but I do think that this will also contribute to students staying enrolled. And because we know that that's the concern for higher education administration about whether students will choose to continue college. If we don't make it harder for them, then we can help them, I think, have a better decision about continuing their progression and their persistence and retention towards degree attainment.
I think in a lot of disciplines, I think I'm the only non-education researcher on this panel. I'm a sociologist and a demographer. And in my disciplines, there's a lot of pushback against, faculty being advocates and being activists. And now is the time where we have to use those platforms to be the loudest advocates and the most connected and on the ground activists that we can be, for our students, but also for the broader communities that our institutions serve. And so I just think, being incredibly unapologetic at this time and doing what needs to be done in positions of power, even as assistant junior faculty, is really important.
I just want to shout out also to our student affairs and student services colleagues out in the audience who are scholar practitioners or practitioners and are joining us to engage in this conversation. I've been thinking a lot about practicing educators like lately because my daughter just started kindergarten virtually, and I'm seeing her teachers just, you know, doing the best that they can and doing things that are really innovative, but getting such little recognition. So I was thinking about the parallels to our student services colleagues as well, and thinking about how little recognition that y'all are getting. And I was talking to a student earlier this week who works in Res Life, and I asked her, do you feel safe right now? Because her campus is about to welcome 9,000 students to campus into the res halls. And she said, absolutely not. And I was just like, I don't know what to do right now other than just to, like, I just want to just shout to the heavens right now. And just like Dr. Harper, as you were talking about these things in your article, it's just like, what are you people doing in power right now? And you brag about having like world-class health researchers and epidemiologists, and you're still doing what? To what? So I just need to say that, and I think that our student affairs colleagues, you know, especially in cultural centers, right? Shout out to our cultural center folks. They're offering, I think, a space even virtually to really engage in hard conversations in this moment. And I think a lot of our students around the mental health piece is, I think people are trying to make sense of things right now, and not having the space to make sense of those things just exacerbates, I think, the mental health pressures and harms. And so I have a lot of questions that, you know, I'm excited to read your article, Dr. Harper, and thank you for writing this, because it sounds like it is documenting all the things I want to throw books out, not books because I'm a bibliophile, but other things out the window right now. Thank you.
Thank you so much, everyone. Trying to decide if we have time for just one quick one. So we're at in the respective time, we are all out. We have 1 minute left, and so I think we may need to conclude for today. Or I see. Okay, wait, one more point.
Oh no, I meant one more question. And one of us could attempt to respond succinctly.
All right. So we do have one more question, and that is related to scholarship. The question is from Deborah Floyd, asking, what advice do you have for scholarly journal editors? What scholarship do we need to encourage? And how do you recommend we do that?
Okay, I'll take this one succinctly. Deborah, I really appreciate your editorial leadership and this great question. So one of the things that, in preparation for writing the article and the congressional testimony, I went and read a bunch of stuff in other disciplines about COVID-19. And it was really clear to me that journal editors were being very responsive to the moment and to the pandemic, and were inviting papers and doing special issues and turning them around in like record time to inform, you know, like public consciousness around this. Look, I'm not suggesting that we ought to go and just like recklessly, you know, publish a whole bunch of papers that are based on nothing. But what I am saying though is that I do think that there's a real opportunity here for higher education journal editors and researchers to write about something really important. This is really important. It would be a real shame if all of our papers about the pandemic appeared in the 2025 year editions and issues of the journals. I think that our policymakers at all levels need knowledge now. They need data and credible publications now in the field of education. And I've been seeing it happen in sociology, in medicine, and in other fields. I bet we could do it here too if we, you know, if we were intentional about it.
Thank you. That was so. That's going to bring us to the end of our time together. I just want to thank all of our panelists for being here to share their knowledge with us. Thanks to all of you for hanging in there with us with this great conversation. I would also like to recognize the ASHE 2020 Program Committee, the ASHE Land Acknowledgement Working Group, and the ASHE Council for Ethnic Participation for their co-sponsorship of this webinar. And thank you to Dr. Julie Park for co-organizing this webinar, as well as to Dr. Jason Gilbo for coordinating the webinar so that we could all come together today. That's it from us. Ahui ho e mālama pono. Take care, everybody.